Let's talk about premiums. I mean, recently, I think because during COVID, the industry and the regulator decided not to burden people anymore and therefore, kept premium rates on hold. Uh, I'm given to understand there's been almost like a 15% kind of a jump depending on which age group and, which policy you have. At the same time, healthcare inflation continues to be in double digits, and which is why perhaps financial planners have always been saying that, look, you have to buy a health insurance first, and a group cover is not enough. Uh, where do you see premiums going from here? Do you foresee a continuing increase? Do you see, with the pool of people, if it expands, if all of what you mentioned actually happens, would you say that, there could be a scope for lesser increases? How do you see premiums going forward?
So there are upward and downward pressures. Okay, upward, like you said, is inflationary pressure. So every time there's medical inflation is very high in our country right now, and that was largely the reason that everyone was driven to reprice products. The other thing is, I think also why the quantum may have been high is that currently regulations allow you to reprice products once in 3 years. So, 3 years inflation is adjusted, right? So that is also, that could be another reason why people were shocked with the premiums. But the downward, like you said, what will bring it down possibly or moderate the impact of inflation? One is more people. So definitely getting more people into the pool is definitely one thing. And the second is reducing leakage due to fraud and wrong claims. So both these things can potentially bring down. And there is a third thing where we are hoping that as an industry, we are able to come together. You must have heard of this initiative by the industry to create a one network for the entire industry, cashless network. So the attempt is to create one network and also collectively discuss with the hospital networks to have better pricing. So if that also happens, then all these three can partially mitigate the impact of inflation and therefore maybe moderate the increases that will be there.